Amanda Dendler, and I'm a current second-degree nursing student here at UH. I'm joined today with
Heather Gray, and I'm also a current second-degree BSN student here at University of Houston. Today we are actually going to be picking the brain of a recent graduate of the class that passed with 100% NCLEX passing rate on the first time. So we want to know everything that she went through so we can be just as successful as her and the rest of her graduating classmates. So with that, we'd love to introduce...
My name is Blessy Oommen. I'm a former graduate of 2014, the School of Nursing. I'm currently working at MD Anderson in the lymphoma myeloma unit. I just finished my NCLEX. I was the last one to finish, but we passed with a 100% pass rate.
That's awesome. Congratulations.
Thank you so
I'm sure
much.
That felt amazing after
Yes.
all this hard work. So we have some questions for you. We want to pick your brain, as I mentioned earlier, just to kind of get a feel of, we've been through 6 weeks and we've got many more weeks to go ahead of us. So we just kind of want to get a feel for what our future is going to look like, and just, you know, for everybody else out there, if they're thinking about getting into this program, some expectations maybe they can set for themselves.
Sure thing. Yeah.
Okay, great.
So how would you describe the progression of the program to maybe someone that's thinking about joining this program?
Okay, I think a couple of the questions people ask is, do they have to be a science background to join the program? And for me, I believe that you don't, because a lot of my fellow classmates weren't in the science program. They had backgrounds that were in engineering or history or even like marketing. And I believe that this program is not only about knowledge base, it's also about how much work you can put in. So as a student that's trying to apply for the program, I believe that it's important that you do get a foundation. So like if you don't have your anatomy physiology in a current year, or like if you don't have a background in that recently, I suggest that maybe a review course would be helpful. You know, that way you can be familiar with the medical terminology, or you can be familiar with just the structures in general. So, and then being out of school, like, so I wasn't in school for quite a long time before I started back in this program. It's great to have a refresher course in order to like just get the feel of school again.
That's actually some great advice, because I know some fellow classmates, and I'm sure this will help future people, is you actually said a key point, is even if you've had those and they did apply to, you know, transferring into the program or getting into the program, they were acceptable, it's a really good idea to take a refresher course recent, if at all possible. So how do you feel that the program prepared you for the NCLEX?
Oh, I think going in day one, I didn't feel like it, but then, but I believe, like, as I look back at it, you know, I believe every day was a preparatory. Like, it made sure that you knew how to take an exam or how to deal with even just difficult situations. This exam is more of a critical thinking exam. Right. It's a lot of being put under pressure, or understanding if you're in a situation, how would you make sure a patient is safe? And this program is very helpful. As you're going through the program, you would wonder, why am I learning this situation, like this case, or why am I learning these words or these extra information? But I promise you, it is very helpful.
I think we're even seeing that now. I mean, they're starting us, even our first test, it was using those critical thinking skills. I mean, I don't think people understand that nursing tests are very different how other tests have been. And so I'm happy to see that they continue, and that they've prepped us even from the beginning on how to take this. So.
And it's a constant learning process, because like in the beginning, you're looking at questions how you would answer it as an undergraduate degree or another former degree, whereas there's an integrative process. And they do, because it is a fast-paced program, they do train you from day one to start thinking like that. And you start thinking as a nurse the day you walk in.
Yeah, absolutely.
So how do you feel the program helped you when you were applying for your job?
I think it's unbelievable, because our last semester is just geared toward professional development. The way you talk, the way you walk, the way you dress. I mean, literally, actually, when you walk in, the first day they'll lecture you on what you're supposed to be doing, or how you're supposed to act as a new nurse or as a nurse. There's a different demeanor or a different stance that you're supposed to hold you know, in society. And so they kind of like give you an idea in all of your courses, like your professional role development classes in every semester. But your last semester is geared toward trying to figure out how to make a career out of your degree. So they like set you up in making a resume, getting your portfolio together, making you presentable, having mock interview questions. Where if you're afraid to do questions on the spot, you're going to be in front of classmates and like in a mock situation where you're actually performing an interview, because they can ask you any sorts of questions. And being comfortable is the biggest thing. So
perfect. That is helpful to know that they're grooming you, to help you present yourself in the best way possible. And mock interviews are great. They can be scary because you're on the spot, but in reality, like you said, you never know what you're going to be asked. So if you get used to being in that situation, it does help decrease the anxiety. So when you're actually in a real interview, that anxiety may decrease because you're like, okay, I got this.
Even when two current students are interviewing, like right now, like I'm sure this was nothing new to you. So.
I mean, most of the things that you need to remember or keep in your mind is be yourself. Don't try to sell something that you're not, because at the end of the day, you're matching with a program that you want to fit into. So it's important to be yourself, be honest, and everything falls into place where you're supposed to be, you know.
Right. So. And that's some good advice. You know, I think a lot of times when we want something really bad, we don't always necessarily think if it's the right fit for us. So then you're trying to mold yourself into something you may not fit into, and then eventually at the end, you didn't fit.
Exactly.
And you weren't successful because of that. So it's best, like you said, be yourself. And this is what I look like, and do I fit into that doorway? And if you do, then great, and you move forward, and you do well because the fit was there. So that was some great advice. Now, you mentioned this is a fast-paced program. There's a lot of information that you have to learn in a short period of time. So what are some of the challenges you faced in this program, and how did you overcome them?
My biggest situation was that you have to be organized from day one, and which everyone kind of excited when they're getting to school. They're so excited and they're already organized. They have their books and their highlighters and everything lined up. Well, during the year, you have to also make sure you keep organized, because you have to make sure that your situations at home and everything else is also in line, because the thing is, when you're not organized, or if there's a little bit of just distraction at all, you can fall a little bit behind, or you can fall like short of what you're supposed to be getting, or your goal. My biggest thing is like make sure that you have a good support system, and make sure that you have a backup and everything. So for example, just some of the questions you want to think before attending the school or the program is, what happens if my car breaks down? What's my second option? Or what can I fall back on if I get sick? Like, what are these situations that you can do as a backup in case something happens, or what is my support system? And that's something that you want to always remember in the back of your head, because if a situation does come, then you know how to face it, you know. And then I'm sure there will be other situations that you can't control, but for the most part, you'll have like a prepared. It's like a disaster kit, you know.
What can happen and how do I deal with it?
Yes.
Ahead of the
Well,
game.
I don't even think it needs to be disaster. I mean, even if like a family member were to make meals for you, I mean, it's not very much a disaster, but that's still having that support system to for you not to have to go home and have to worry about what you need to cook up that night, or if you have kids. I mean,
Yeah, I have 3 kids.
Yes.
My youngest is 8. I'm just blessed that my 10-year-old loves to cook.
So.
My husband's in oil and gas, and so he travels a lot. And when he's not home, I have an amazing little clan at home who loves to help mommy. They're very excited, and that was something we've talked about, is even that is something that some people can find to be challenging in the program, and definitely something you have to think about. But like I said, it's all about the right timing about things, and doing things when it's appropriate and the right time for you. And
Correct.
like I said, I'm very, very blessed that I have some talented cooks. And that's what from the making.
And did you have mothers in your program? I mean,
I'm a mother.
You're a mother. See?
I have a 12-year-old, so I'm a mother, and I also was a single mom. So myself and a few others were actually single moms, so single parents, and so it's doable.
amazing.
It is so doable. Of course, there are times you're going to go back home and you want to cry under your pillow, but you know, and we say that okay, it's great to have a support system, and some people are not fortunate enough to have their families with them around, or and you become like I guess organized in the sense at home also, because you became like an expert on trying to like cook your meals for the week, and like because it's very important to stay healthy also. So TV dinners are probably not the best thing, and I'm sure quite often I had some, but you know, like you just want to make sure that you have a plan, and that's the biggest part of it, you know. Whether it's you yourself and your family, or if it's a support system with friends, and if you're here as a young adult and who doesn't have a support system as far as family goes, you have friends and people in the program that know what you've gone through or you're going through. So it's good to have that.
So do you feel, I know we kind of talked about this, but what do you feel were your study habits when you first joined, and as you progressed through the program?
I think when I first started the program, I think I wanted to read everything. Like it was like, oh my gosh, I'm going to read 10 chapters within the first week of school. But you learn to prioritize like your items and what you need to learn for class.
Right.
A lot of the stuff you don't want to miss a class ever. You want to make sure you pay attention to everything you go through in class, because that's going to be your helpful key. Like whenever, and people say, oh, well, everybody has a different teaching style. And it's true, everyone does have a different teaching style. But apparently everyone here is here for a reason as far as faculty, and they have a background, and otherwise they wouldn't be here. So it's important to have those different teaching styles, because one of those teaching styles will work for say one individual, but another teaching style may work for another individual. And this program is great about that, like having to use all your senses in order to like learn. So try to do that. Well, I did this at home, is where I would make a little sheet of paper which was blank, and I would write my key points on my paper. And so that was my points that I would go over and study over, you know, instead of trying to study everything. I try to think, what would they possibly ask me that is high yield? What can kill a patient? What can make sure that the patient is stable? So that's what you want to kind of organize yourself as you study.
That's some great advice. We always talk about studying, and studying can be very time consuming, right? And we've talked about organization and managing your time well. So with that being said, there's only 24 hours in a day, right?
Correct.
So I know this is a very personal question, and just like there's different learning styles, everybody varies with the amount of sleep. I'm more that as long as I got 6 hours, I'm good to go. As a mom, I'm kind of just, that's a blessing. You know? But as a student, I found myself struggling sometimes with, oh my gosh, should I be going to bed, or should I be staying and studying some more? And I can put some more hours in there. So what did that look like for you?
Well, of course, as a student, as much as I want to have 6 hours of sleep, there were times where I didn't. And that was probably the biggest mistake that I've made, is if I look back now, it's very important to get your sleep and eat, as we talked about before, eat healthy. You want to make sure that you don't, because as you get less and less hours of sleep, you have more chances of getting sick, you know, and you don't want to get sick in the program. And then also studies show that 6 hours of sleep actually kind of form memory. Long-term memory. So in order to take your short-term memory, what you learned in school, and to put into long-term memory, you want to have a minimum of 6 hours of sleep. If you have less than 6 hours of sleep, you're kind of functioning at the level of a drunk person. So your cognitive level is not the level of what your expectation is.
And that's not something that we want to put the patient in. Like when we go to these clinical settings, we don't need to be putting a patient at danger because we couldn't get our sleep in. And so that's a very good point, like, of getting the 6 hours.
Yes.
I actually like to reference about the drunk person. I remember watching something on TV, and they actually did a comparison with somebody who was drinking shots, like legitimate drinking shots, and then somebody who was sleep deprived. And the person who was drinking, not that I'm condoning this by any means, but actually did better driving than the person that was sleep deprived. And it makes complete sense. Your body just starts to shut down. So I'm glad we actually talked about this. It was a very good comparison, and something we need to make sure that we are getting enough sleep And as Amanda mentioned, we don't want to put when we go to clinicals, we don't want to put our patients at risk by being exhausted.
Exactly. Or even just your functional level in your testing abilities, right? Because a part of it is you're not able to think properly. And so if you cannot think properly, how could you answer a question on your test?
Absolutely.
So a lot of people think, okay, well, and I'm guilty of it too, you cram until the last minute to like a minute before your exam. But actually taking a break and relieving yourself from that cramming session, just give yourself a cutoff time. When you have a cutoff time, that was your last time to study, and then the rest of the time, you just refocus yourself, rethink yourself, like have your mind in a state of like less anxiety, because I feel like the more you try to study and cram, the higher the anxiety level is, and the harder it is to actually do your test, because you cannot take a test in a high state of anxiety.
So how did you manage your time in terms of personal time versus school time?
I'm sure you're in your class right now where you get the pie, and you have to like write or just basically divide out the pie, the circle of what your expectations of your time is. I think when I started my program, I was like, okay, within the first couple of weeks I said, okay, I'm not going to have time to do all this extra stuff. And it is true, you will have to prioritize what your times are, like what your the events of your day are. So of course a lot of it goes into studying, and a lot of it goes into, but don't forget your family. You want to keep your family time, and you want to keep your loved ones or individual time, because if there's something called a burnout. So if you do not have that time for yourself, you will burn out, and it can quickly happen, or it can even take a long time to happen. And no one knows when the time is when you burn out. So it's very important to it's not a lot of time, but I'm not saying take a whole weekend off and let's go off and party. No, but you want to take a couple hours a day to take a break away from your studying, to breathe, take a walk. Exercise is very, very important. Exercise is a form of stress reliever. It releases like cortisol, and you're able to deal with the stress in a better situation. So it's very important that you take your time.
So it would be okay to go get a manicure.
Yeah, it'd be great.
I don't have to.
As long as there's no polish.
No polish. No polish. Awesome. Well, I know we've touched upon a lot of different aspects, but if there's one thing that you wanted to make sure to get across to us as actually current students and anybody who's watching this who's thinking about this as a program that they're interested in, what would be something that you think would be one of the most important things that you could tell us right now?
We talked about it a little bit before. People always get intimidated the fact, okay, I can't be a nurse because I have no science background. And it's not true. One important person told me one time, it's not about how smart you are, it's about how much work you put into. So it's a matter of how much you want to reach that goal. There's that show, The Survivor, and you don't make it to the end unless you're ready to survive, and you know that you have that in the back of your head, you're strong with that concept, that actual end goal. And that's what's important, is that you keep focused to the end goal, no matter what happens. There's so many times that you want to break through the program, but they have great faculty that you can talk to, and there are people around you, just a support group. You're going to hold on to what is important to you, because that's what's going to be the one that reinforces what your goal was. Keep reminding yourself. If you write it on a mirror, write it on the board, and says, this is my end goal, and this is what I plan on getting to be, you're always reminded about that whole point of what I need to get to. And that's very important.
So I will graduate 12/12/2015. Yes, for me.
And people always think, okay, it's a program, programs are not organized, blah, blah, blah. But the problem is, every program you go to is not going to be organized, or is not going to be, I wouldn't say organized, I would say ever-changing, because you want a program that's ever-changing. You want to be able to get a program that's going to adapt to the current situation, because if they're not changing, something is wrong. They're not improving.
And current nursing standards.
Correct.
I mean, this is a profession that changes almost daily.
Constantly.
In terms of what works best for the patient, what works best as a team, and so I'm glad that we're kind of in this program that adapts to those standards.
Yes. And it is a fast-paced program, but we are lucky to even have, because there's not many programs in the U.S. that are just a year program or a short-term accelerated program. So we're already in a I guess elite status to be able to have that privilege and take that privilege as an opportunity, and rather than thinking about or complaining about it, think it as an opportunity to achieve your goal. So.
And it's doable.
It's very
judging
doable.
on 100% pass rate that you all guys.
Yes.
Yeah,
I mean,
so-
you have a strong foundation, and it's like any foundation. If your foundation is great, it's perfect because you can build up on it and it'll stay. Even if you need a new paint job or you need to change up the house a little bit, your foundation is still strong. Where if you're in a program where it's not strong, you can have nothing to base it on when you go into that NCLEX, which is the hardest of all exams. So.
Yeah.
Right. As far as the NCLEX is concerned, what advice can you give us as far as timing? I know probably some people want to take some time off and let their brain rest for a little bit, but tell us a little bit about your thoughts.
Okay. Well, as soon as you graduate, it is good to take that weekend or just a couple days off to regroup and breathe for a bit. But I would say that as soon as you're done, start preparing for your exam right away because you want to take your exam as soon as you can. And every individual is pretty much can gear how ready they are, but you'll never feel ready for this exam. You're always constantly like trying to keep up with the exam. And it's very important to take the exam as soon as possible because you're basing it off knowledge that you've learned throughout the whole year versus trying to cram in a three-day course or a week course, which they're great because they will hold a refresher for you, but you're basing it off of knowledge and experience that you've learned throughout the year. I remember taking looking back at the question and seeing something that I learned in sim lab, or in even in clinical. So you want to actually hold on to those experiences, and the sooner you take it, the sooner you can pass. I would say not to take it or prolong more than 3 months maximum. It's because the longer you take, the harder it is to pass. And statistically, they show that. But I mean, if you could take it within a month or 2 months, that would be great.
Perfect. Now, we all have prep U's.
Yes.
Lots and lots of prep U's.
Well, let's describe first what prep U's are. So prep U's, we use a lot of technology in this program. So for the prep U's, there are adaptive quizzes that they give us weekly, and they give us, anywhere between 12 to 3 quizzes, and you build upon that until you reach these certain levels. So on these prep U quizzes, how would you expect us to kind of look at them now?
Well, the perfect thing about the Prep U quizzes is that's the only way to test your knowledge. How do you grasp something that you've read if you don't test your knowledge? So doing the quizzes are amazing because it'll help reinforce everything that you just read, or if you don't know something, oh, I just learned something new, So that helps you because it tries to reach areas that you haven't reached, and if they the key points that they know is high yield, if you haven't reached those areas, it'll introduce that to you until you can get the concept. And it's not about memorizing. When you read a book, you read and you memorize, but it's to be able to apply it to a question. And that's why the prep U's or the questions are really good. You would think it's tedious because there's so many questions and there's a lot to do. But I found myself even doing questions while I'm in the grocery line. So, it's important because that's what helps you toward preparing for the exam. This year is very much of a sacrifice. You want to gear everything towards studying for preparation of the NCLEX, and that's a big thing. So doing questions every day, I promise you, it will pay off at the end because you're exposed to over thousands and thousands of questions. So when it comes to your exam, you're kind of already prepared of what you need to know, I wouldn't say what you need to know, but just the experience of it.
How to approach it and break it down.
Correct.
Well, thank you for joining us today.
Thank you.
I really appreciate, for me, as a current student, just hearing this advice. And so I'm sure for you too.
It's been very insightful. It's great to hear another mother that's in here, and I'm sure that this is really going to be helpful, not only for the rest of our classmates who may be having that struggle with, is this the right program for me? Because there are some decisions, that our fellow classmates are having to make right now, and so this might be very helpful in trying to make that decision about what their future is going to look like, or even just how to approach an alternative program, anything like that. This has been really, really helpful, and I appreciate you taking your time out of your day and coming to meet with us.
Well, thank you for having me.
And congrats again.
Thank you.
Congrats.
Thank you so much.